up and get you ready for the collaborative approaches to the management of pain. That's what the formal name on paper, but many of us refer to this as Pain Day. And everything. And so I'm really excited that we're heading into to another year of this. For those of you who are new, you'll be hearing, we'll go through what we're expecting, how the session to run on April 7th. But for those of you who were involved last year, we're not making a lot of changes. It's just little tweaks and everything. And for those of you who've been involved for quite a long time, we made a lot of changes last year and got a lot of positive feedback on that. So my name is Lisa Mendez. I'm an occupational therapist. I work in the Office of Interprofessional Collaboration. And so this is one of the babies that I lead, but I'm not doing this alone. I have a very robust and well-rounded working group represented, having many of the professions represented and everything. And so I'm just the guide that spurs things along. So for those of you who've been involved for a long time, but were just missing last year, some of the updates that we made is that we streamlined a lot of the case and readings that were provided to just really zero in on what we thought were the core messages and information. Because we have such a strong support from our facilitator base, we're able to provide learning situations where it's just groups of about 8 students in each group. And so it'll be a really nice group to facilitate, to make space for lots of voices to be heard and hopefully have a lot of conversation. And we also made some changes to make sure that our conversation doesn't get too drawn down the path of pharmacological approaches. And so there's lots of cues there to make sure that we're really looking at this case from a very holistic lens of providing support to this woman, Abigail. Another change is we've been able to secure enough rooms that everybody will have a room that is set up to feel like a team meeting kind of room. If your room is set up kind of in a more of a teacher at the front situation, have the students rearrange the rooms so that you can create some sort of a circle or a square that everybody can face each other, versus having, we should not have any rooms where the chair is bolted in and everyone's forced to face the same direction. So this year we have about 360-ish students from 7 different programs. New this year is that all of the students from nursing, a 4th-year nursing student program or 4th-year nursing class and students in midwifery will be able to attend as part of their program. In previous years, it was more on a volunteer basis because they didn't have any scheduled classes. So for those of you who've been involved for a while, you'll notice we're earlier in April than we normally are. And this is just to accommodate that schedule. So we're really excited for that change. You will be receiving a number of handouts that have just been finalized. So those should be coming out soon. The 2 main pieces are the guide that I'm going to be putting on my screen in a moment, and the chart or the patient information that's going to come your way. The guide is just for you. The students will not have it. And the chart is almost the same as the students, but you will have cheat notes on one of the documents to help highlight some language that we have intentionally left to spark some discussion when we get to the part on stigma. Those 2 documents will be printed and ready for you in the room. so that you shouldn't need to bring a laptop. You're more than welcome to, but you shouldn't need to. But we'll also give you some other articles or some other documents. One are some articles related to stigma that the students will have. And we'll also have a cheat sheet, some more cheat sheets. One is around different roles that the different professions will have, and one is a pharmacological cheat sheet. I would say that those have just been sparked from folks saying that it would be nice to have, but they're not meant to be, something that you need to teach from or whatever. It's more just if you're curious or just want to freshen up or that kind of thing. That's meant kind of thing. So on that note, unless there's any discussion, I'm going to start sharing my screen and walk us through the guide. One of the things that we do know with these students is that some of our programs have way more students than others. So the nature of how the groups are formed is just influenced by that pragmatic. And so as Catherine's massaging the group numbers and everything, we're aiming to have 5 students that are either from nursing or medicine. So it'll be 2 of one, 3 of the other. Every group will get an OT student, a pharmacy student, and then at least one more other. It may be an extra OT pharmacy. It may be somebody from midwifery, from NP, social work, psychology, PA. Oh, makes me nervous in case I forgot somebody that might be participating, but that'll more or less be what your group looks like. So you will have just a larger number of some students. So that'll be part of your facilitation as we go through this, is just working with knowing that our groups are in balance and making sure that all students feel that they have a voice. All right, so now as I go through this guide, you're seeing my, Catherine, I can see you. Can I get a thumbs up that you can see the guide? Okay, perfect. So the first cue here is, first I'll draw your attention to my cell phone number and Catherine's cell phone number. I am the last kind of backup person. So assuming that everything goes to plan, I'll be floating around and supporting folks as needed. So as I mentioned, we're going to set up the room in kind of that team piece where there's no expert at the front. We're creating that space. And then here's just a general overview that I'm going to walk you through. So your role is, some of you may be absolutely have a lot of expertise around pain, and some other folks not so much. Every group will have 2 facilitators. We're going to try to balance out profession, level of experience with facilitating this group, level of knowledge with pain, and everything. But your job, regardless of what you bring to the table, is just to really facilitate the students' conversation as they work through this case. So we want to make sure that all voices are heard and that we're using multiple viewpoints and strategies to work with people with pain. And so this is kind of a guideline, but like many things, it doesn't need to be followed exactly, but we just provide it to make sure that you feel supported and you know what's happening. In your package, there will be a QR code that the students can use to sign in with their phones. So that'll be something that you can do at the beginning as people arrive. And then we're suggesting that you start with a territorial acknowledgement. You can use your own, or you can use the university's. And then we just get straight into the session. And so I didn't specifically mention, I just said over 40. So we've got 43 people that's either faculty, members from the university, or folks from community practice settings providing support. And here are all of our kind of setting the stage for the learning event. And so just highlighting the importance of pain and highlighting all of our sessions that are related to working as a team around pain, and reflecting also on how things like gender, race, and socioeconomic factors can influence the lives of folks living with pain. Then once you've introduced yourselves and introduced the topic, you can have the students introduce themselves. I like to start off with, my suggestion is just something, a gift, something that they'll bring to the session. It can be personal, professional, however they interpret that. And then just to set the stage, something they know about their profession, their profession's role in supporting a person who's living with chronic pain, just to kind of set the stage. So the next thing we do is we meet Abigail. And so one of the facilitators, so there'll be facilitator 1, facilitator 2. So if you're 2, you would read out this next line. What we've learned in the past is that not everybody knows what an access center is. So there's little optional components that you can read out or paraphrase to set the stage for where this is happening. And because the students are simulating that they are a part of a My Health team at an access center, and they're going to be working with this new referral. So although the document is now in like one long document, you're going to just start with reading the referral letter before proceeding to the rest. The students will have had access and should have read this already, but we want to kind of stop and have a discussion after that first referral letter. And the first conversation is just, you know, kind of what do we know? What are our first impressions? So kind of that pre-assessment image of before we've even gotten to know this person. And so there's a lot of cues to talk about with the students that if they, you know, if they organically come up with these, great. If they don't, and you're kind of feeling like you need to nudge, there's some ideas to push along. We'd like to suggest that if non-pharmacological aspects haven't been raised yet, bring that, because the referral does talk about CBT. So just questioning, you know, has anyone learned about this yet? Can anybody give an overview of what this might look like? You know, and so there's some little cues there of what you might guide along that way. So once you've had that kind of pre-assessment image, we're going to meet Abigail. And so in this situation, facilitator 1 and 2 just do this little role play reading this out. Then we kind of do hit pause again and just ask for a quick overview of the medication. So really, like, what do these medications tell us? What do we think's happening, or why do we think she's taking these? Just to make sure everyone's on the same page, because for some of our students, the medications will be quite unknown to them. All right, so after this quick little piece, we're going to stop and ask the group to come up with, okay, where do we go next with Abigail? What questions would we like to ask? And so on this, we're going to try our best to make sure that all of the rooms have a whiteboard or a chalkboard or those sticky notepads, because one person is going to one facilitator is going to draw a large circle in the middle, which is where questions where more than one profession would ask that question. Then as questions come in from others where it's probably likely just that one profession that's going to ask that question, we'll put it in a smaller circle on the outside. The spoiler alert is that we're anticipating that most questions will go into the middle because we're wanting students to recognize that many of the questions they'll ask are perhaps more alike other professions than others. It's just how, and so then we want to lead the conversation to how that might feel for the client, or how our questions might differ, kind of thing. And so, you know, everybody might be asking, you know, are you able to work? But how folks are going to use that information might be different. So once we've got kind of these are the questions we would ask of Abigail, we go back to that document of the chart, and we receive all of the other information that's in there. And so then you can go through these. If you can kind of get a vibe from the group if they're familiar to them, if we've given them to read in advance, and just how, if you want to stop and reread some of them, or if you just want to move forward, kind of thing. The latter ones are less, like the patient health questionnaire and on, are less, you can just quickly look through, and perhaps ask for some folks to give a summary or just a quick, what have they noticed. This writing that's in blue or in brackets afterwards are just some cues for you to ask some questions. And so in the urology content, you might want to actually ask what's missing from this report. And we're just asking for you to ignore any language that maybe you wouldn't normally use in practice, because we're going to come back to that. I've got, Catherine, I've got my screen minimized to see people. So if there's any questions or things I should be aware of, I can't see you. So just unmute and let me know. Okay, now when we move to this development of goals and action plans, this is where we want the students to start looking towards her priorities of what we would like to work on for her. And so the intent of this is to recognize that some folks might actually have very similar goals. And so how might we manage that if more than one profession has the same priority? And so we've given you some cues there where maybe there's a divide and conquer, maybe there's one person who takes the lead, that kind of thing. And then there's also some other prompts of, once we've got this list, how might we engage her, or there's also some prompts if there's an area that's missing. Now, I want to say that this is called, Pain Day, or Collaborative Approaches to Pain, but we also know that this team will want to look at her holistically. So we don't need to just zero in on the pain. There are other components of her life and of her care that I need to be concluded in the picture as well. And so please, just like in practice, don't just narrowly look at the pain. And then, so that kind of, from at the end of this piece, is that we really should have, this is where we want to go, and this is how we're going to get there. And so that kind of is as much as we get to with regards to creating a fulsome plan for Abigail. In the sixth section, we switch gears to talk about known factors to influence how pain is treated in our healthcare system. And so it's very strategic that Abigail is a person of color, is female, and that we're dealing with, and that she's living with chronic pain in her pelvic region. And so all of which can create some comfort, discomfort, bias, stigma, and all of those kinds of things. And so this is an opportunity to talk about that. And there's some little bullets there about what the research says about pain and stigma, just noticing that, practitioners can tend to underestimate pain, and that whole piece of, sometimes the more exposure we have doesn't necessarily mean that it decreases our bias, and that we constantly need to examine our biases. And so there's some cues there that you can discuss. And then finally, what you'll do is go around the circle and just ask each student to share something that they learned or appreciated about this session, and something they'll take forward into their career. And then there'll be another page with another QR code for the students to give feedback. So on the note of feedback, I want to share what the students really appreciated last year, because just to kind of give you a sense of what we're going for, because this is exactly what we wanted, kind of thing. And so some of the key things that the students appreciated was just like how collaborative the session was, and how much they learned about collaboration around a really authentic case. A lot of students talked about appreciating how the facilitators helped, like had used their skill to help guide the group and kind of nudge and make sure everyone had a voice and to kind of guide that session and their questions and everything. A lot of students talked about their appreciation for learning about the overlap and just having like specifically spending some time about navigating that. They appreciated that it was a realistic case. And they really liked the safe environment that we were able to create with the small group and everything, and that they appreciated the discussion around the stigmatizing language and just being able to take some time around that as a group. And so I think all my tiny sticky notes of things to make sure I say are covered. So now I want to just ask what you think I might be missing or is unclear, or tips from previous facilitators they'd like to share.
Lisa, I can say something. I can turn my camera on too.
I was looking at
In
your
the
EB when I said that.
Yes, it's me. I think what was helpful in the past was when you sent along the like our co-facilitators ahead of time, so we could try to reach out to them and at least make a bit of a game plan. So I found that really helpful when I could do that the first time I did it. Um, so that would be great. And then I don't know if you're still planning on having that room available beforehand, because then that was a nice way to get connected with your group and share and whatnot.
Absolutely. Yes, that's on my, yeah. And so you'll notice in your calendars, you've been invited to an optional, I think it's called pre-huddle or something like that. In days gone by, it would have included lunch, but that's not our lived reality anymore. So it's a BYOL. And you can just come together. Lots of folks just appreciate to being connecting with folks that maybe they know from their own profession, that they haven't seen in a while, folks that they're going to be facilitating with, just some time to kind of get your head in the game, to review the materials. Catherine and I will be there. We're also going to be sending you a map for those of you less familiar with Bannatyne campus and helping you sort out if it's got an R in front of it, what building you're in, if it's in a P in front of it, what building you're in. Because we know that wayfinding, even for those of us who are on this campus, sometimes have trouble with that. So yeah, thank you. We will do that sorting out, and also acknowledging that that we won't commit to officially who your partner is until 2 minutes before the session starts, because just in case things happen. But for the most part, everything should stay fairly consistent once once we're able to send those out. Anything else that's unclear or? All right. So then I'm excited to meet you all on the 7th. I'll see you in that pre-huddle room if you're able to make it. If not, we'll get the packages to the room that you're going to be in. You just need to kind of bring yourself. If there's any of the additional documents like the readings on stigma or the cheat sheet or that kind of thing that you want printed, you can ask us. Otherwise, we'll just assume that you either will review it in advance or you don't necessarily need it. They're kind of just supplemental information, but we'll have the documents that you need printed out for you. If you notice anything that you would like changed, kind of thing, and you're an in the moment person, please feel free to just write all over that document and hand it back to us, so we can integrate it for next year. So we're always trying to ensure that this is a meaningful session for all of the students, so, and the facilitators. We really appreciate how many folks have stepped up and come forward to support this really awesome learning opportunity. So I can't say thank you enough, and I just really appreciate the diversity of the folks that are helping out. We're really role modeling coming together, so I'm quite appreciative of that. Leanne.
Quick question, preparation package for our students, is that in the works? It will be sent
It's ready
as one
to go.
big file?
Yeah.
Okay.
What I'll do is I'll connect with my contact in each program. It may be the person on my working group, or it may be somebody else, and I will give you the information, and then you can decide how you disseminate, but it'll have some documents. Catherine and I have had opposing schedules, so we're just needing to pull that together, but it's pretty much ready to go. Okay. Anything else? If you don't have any other questions, you're free to go. Thank you so much for giving up your lunch time, and I appreciate you joining today and for coming on this coming on the 7th.
Thanks, Lisa. Thanks, Leanne.
Thank you.
Thank you.
Thank you all. Bye-bye.
You can hit stop, just like with teaching.